Hey everyone, in this video I will talk about rationales for inserting IVs for patients in hopes to provide clarification on a topic that I was not 100% sure about. In this channel, I talk about all aspects of nursing, from pre-nursing to postgraduate programs. If you want to learn more about nursing, consider subscribing and giving this video a thumbs up. I would greatly appreciate that. I also have a free 45-day NCLEX guide on my website, www.simplefitnurse.com, that you can download. As I have mentioned in the past, the emergency department has a lot of autonomy for practice as an RN. Sometimes there are orders that are in place for inserting IVs, and other times it is up to the judgment of the nurse as they're waiting for the physician to see them. Now, the physician may be a while before they get to see the patient, as there are many people who are quite sick and require immediate attention, while there are others that have time to spare. As an emergency room nurse, one of the most important tasks you have is to act proactively and determine what is the most amount of intervention you can provide to better the outcome of the patient until the physician comes and assesses the patient themselves. Now, this is part of nursing that I enjoy. It is the critical thinking aspect where you have to decide what is best for the patient. However, inserting IVs was an intervention that I was never sure about until I learned about these things. Number one, cardiac related events, you insert an IV. Septic patients, you insert an IV. Soft blood pressure, insert an IV. Anemic patient, insert an IV. And lastly, nausea or vomiting, insert an IV. These were some of the situations where IV insertion was absolutely crucial in ensuring the safety of the patient. If the patient was to have an arrhythmia that was not normal for them, then it was crucial to get an IV site, as I do not want the rhythm to change to something lethal. Therefore, for the safety of the patient, is always important to ensure a patent IV line so that you're able to give rhythm reversing drugs such as atropine or adenosine or other medications as well. As for a septic patient, we want to try and promote more circulation in the veins so we can ensure adequate perfusion to vital organs. That is a topic that will be discussed later, but if I see that a patient is febrile, has an elevated lactate, and is symptomatic, that could be signs of an infection. Inserting a line and placing them on a drip to keep the line open until I get parameters from a physician is always a good idea. The other reasons are quite obvious. Really soft blood pressures with symptoms associated that could indicate further deterioration, such as lightheadedness or dizziness, are classic indications to start an IV and place them on a bit of fluids until further guidance from a physician. If someone has chronic anemia and comes in with symptoms of anemia, another great indication is to start an IV because you'll most likely be transfusing red blood cells. Lastly, if the patient is nauseous and is vomiting, we want to provide active treatment to get it under control right away to further exacerbate the problem. Anyways, if you have any other questions or reasons and rationales for situations you think it is necessary to put an IV, I would love to read about them in the comment section below. Thank you so much for watching, and I will catch you in the next video.